Good morning, Brian, who is joined remotely. Can you hear me? Sound test?
Yeah, I can hear you loud and clear.
I can. Excellent. Thank you very much.
Order and ask the secretary to call the roll, please.
Director Garza, Director Kim, Director Sorrell,
Present.
Director Webster Cross,
Present.
Chair Bott,
Present.
and for the record, those directors also present. Director Harrington,
Present.
you have a quorum.
Thank you. I'd like to entertain a motion to allow Director Sorrell and Director Webster Cross to remotely participate in the meeting as voting members.
I'll make the motion.
Motion made. Any second? Is there any further discussion on the motion? Hearing none, then all in favor say aye.
Aye.
All opposed? Ayes have it, the motion carries. Thank you. The next regular meeting of the Quality and Patient Safety Committee is scheduled for Friday, February 21st at 9 a.m. Is anyone registered to provide in-person or virtual oral testimony or submitted written testimony?
We did not receive any registrations nor any written testimony.
Thank you. I will move to our action items, approving appointments, reappointments of the Sturgeon Hospital Department Division Chairs. One department chair reappointment is being presented, reviewed by Dr. Kamaple, Interim Chief Medical Officer. Thank you.
Good morning, Chair.
Good morning.
Good morning, Department Director. So I respectfully request approval for the reappointment of Dr. Jorel Alexander to the position of Chair of the Department of Oral Health for a 2-year term extending through January 31st, 2027. Dr. Alexander completed her dental residency in Rush in 2008 and joined Cook County Health in 2013. As Assistant Director of Oral Health and the Chair of the Department of Oral Health. She currently oversees all our CCH Oral Health clinics, which are 15 in number, 9 in ACHN, 6 in CEMAC. She also has joint programming responsibilities for the delivery of care with our FQHCs at Northwestern Medical Center. Thank you.
Thank you so much. Any questions? All right. I'd like to entertain a motion to approve item 3A, the one proposed Georgia Hospital Department Chair reappointment.
I'll make the motion.
Second.
Any seconds? All right. Motion been made and seconded. Any further discussion? Hearing none, then all in favor say aye.
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 All opposed? Ayes have it, the motion carries. All right. Thank you so much. Now we'll go to the EMS MEC reports, action items. Sturgeon Provident Hospital Med Staff action items that are being presented for approval. Sturgeon Provident Hospital Quality Committee summaries presented for information. To Dr. Akintoran, President of Sturgeon Hospital Executive Medical Staff, presenting reports.
Yes, good morning.
Good morning.
Morning.
Okay, thank you. All right, this is the summary report of the HQPS committee to the EMS. We do have the minutes, but this is summary just for your information, directors. The highlights of this summary report and the areas of patient experience. Grievances are resolved within 30 days, which maintain a 100% resolution rate as at August 2023. And over 2,000 employees completed CI care training, fostering professional and compassionate patient interactions. Patient testimonials highlight exceptional care, courtesy, and professionalism. Radiology. The goal for the X-ray port start turnaround time is 1 hour. This is being consistently achieved, was consistently achieved in August and September 2023, which was at 0.92 hours for both months. The ED ultrasound start turnaround time goal of 2 hours was also met in the same period. 1.85 and 1.5 hours respectively. The area of ambulatory services, significant progress in colon cancer screening compliance through the improved fit kit protocols. New processes for fall risk identification in clinics led to enhanced patient safety measures. Naloxone distribution programs expanded to 9 clinics, demonstrating a commitment to addressing opioid overdoses. There were no action items presented to the MS committee, and there are none being presented today. Thank you.
Thank you. Any questions? All right. Thank you, Dr. Allegretti.
Sorry, I
you
also
present
present the.
Provident.
What about the? Excuse me. Do
Go
I come
ahead.
back for the credentials?
You can do it now.
Oh, okay. Thank you. Thank you, Chair. So I present to you the report of the Credentials Committee, which is the listing of medical staff, action items, appointments, reappointments, and others. So you do have the list of doctors that were providers, credentials in that period, approved by Credentials Committee and approved by the EMS Committee that's been presented to you today. So you have that list before you. If there are any questions, I'll be glad to answer.
Any questions from the directors? And is there more recruitment in terms of any particular areas of clinicians, more so than others, general medicine or other departments?
I believe the same recruitment efforts have been applied across all our medical specialties, and the Credentials Committee and the system leadership, they're working, I say, equally, for all areas that we have needs and shortage.
Yeah, there's a few places that are of keen interest. Anesthesia. Yeah, there's hematology, right? There's a few of those radiology departments that we're really focusing in on.
Great, thank you. All right. Okay, thank you, Dr. Quintorn.
Thank you.
I'd like to have Dr. Allegretti, President of Provident Hospital Medical Executive Committee, presenting reports and medical staff action items. Committee's consideration approval.
Good morning, everybody.
Good morning.
We have submitted the report for the credentials meeting that met on December 24th for Provident Hospital, and they are submitted. And I'm here if you have any questions or comments.
Any questions from directors? All right. Thank you.
Thank you.
I'd like to entertain a motion to approve item 3B, the Sturger Hospital and Provident Hospital medical staff appointments, reappointments, and changes. All right.
Second.
Second.
Thank you. Motion been made and seconded. Is there any further discussion on the motion? Hearing none, then all in favor say aye.
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 All opposed? Ayes have it. The motion carries. Thank you, Dr. Quintorn and Dr. Allegretti. And before I go to the minutes, I just want to say that I'd like to just share our, on behalf of the board committee, our gratitude to Dr. Kamople for stepping in the interim role, and appreciate your contributions. Thank you. Go to the minutes for December 11th. 2024. These minutes were approved at the December board meeting, so being presented for the committee's review and discussion if necessary. Any corrections need to be made in minutes, directors? Okay, I'd like to entertain a motion to accept item 3C, the minutes of the QPS committee meeting of the December 11th.
Make the motion.
Seconded.
Motion been made and seconded. Thank you. I think that was Director Sorrell. Is there any further discussion on the motion? Hearing none, then all in favor say aye.
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 All opposed? Ayes have it. Motion carries. Thank you. Now we'll move to operational excellence, review and discussion. No action needed. This is, these are informational items, so we'll have, our team, from quality and safety. Thank you, Raji. Want to kick us off here on OpEx dashboard goals and tactics.
Good morning, Chair.
Good morning.
Directors. Happy Friday. Based on the feedback we received from you all, we have made some changes to how the monthly operational excellence dashboards are presented here, along with how we would keep the board appraised of the great work that's happening at the site level, at the work group level. We will explain all the changes on this last slide in this presentation. However, one of those changes we are making, which you would see in action shortly, is that, the monthly dashboards will be presented jointly by the Chief Quality Officer along with the Chief Hospital Executive for Providence and Chief Hospital Executive for Georgia, and for Providence, it would be our Chief Administrative Officer. We believe this new process, this change will allow for our Chief Executives over each of the sites to provide operational elements of, the tactic implementation while we continue to provide, quality components of that work that's happening. But we would continue to seek input from you all to make sure that this new structure, this process, does meet the needs of the board. We are providing the appropriate levels of information with the board, as well as with the public, the communities we serve. Up on the screen, we have Providence first. So I have the pleasure of Dr. Turner joining me. Dr. Turner.
Good morning, Chairman Bach, directors. Happy New Year. I want to go over with you the operational excellence dashboard for 2024 for Providence. We had 5 metrics that we were looking at. The first one in the top left-hand corner is communication in the nursing domain. In 2024, we did not meet that metric. In 2023, we're at 76.08% compared to 2024, 75.53%, slight decline. We'll continue to work on this in 2025. With a higher return volume of responses from patients that we're now getting, we believe our current scoring is more indicative of the baseline true performance. Next is the survey response rate. That was at 12.7% in 2023. We increased it to 14.3%. And 2024, a percentage increase of 12.6%, showing improvement in a positive direction. We'll continue to work on that. With respect to clinical outcomes, with sepsis, we were at 46.15% in 2023. In 2024, we increased it to 55%. That still was not our goal, but it was a significant improvement, showing our work resulting in a step in the right direction. We continue to work on this, working to increase the volume seen in CMS abstraction. And also, one of the key areas we need to improve on is the repeat lactate levels. In November, however, we were at 100% compliance. Hand hygiene, in 2023, we were at 80%. In 2024, we increased to 85.6%, resulting in a 22.3% positive percentage change and improvement. We plan to move this indicator to the sustainable next year. Our last one was with throughput, left without being seen. In 2023, we're high at 6.48%, and we brought that down in 2024 to 4.78%. But in recent months, we've actually been between 1% and 2% rate as far as our left without being seen, and over a 20% reduction in percentage change in the positive direction, and we'll continue to work on that in 2025.
We would be happy to take any questions from the board.
Any questions from directors?
I just don't understand what this SEP.
Director Kim, can you get closer to the mic? Thank you.
Could you explain a little bit about SEP one?
That's the sepsis.
That's the sepsis bundle.
Okay.
Sepsis is a condition that results when someone has an infection that can.
Yeah, I know that.
Okay.
What's in that bundle?
Oh, what's in the bundle? It's looking at the lactate levels, blood culture collection, blood culture acceptable collection, and application of broad spectrum antibiotics. Those are the 4 things that are in the bundle.
Director Kim, if you are interested in knowing more about it, we are happy to send you additional information.
Thank you.
And could you talk a little bit about what's the plans to continue to improve compliance? Seems like there's been progress there and great progress on hand hygiene, but on sepsis, what you're going to do here moving forward over the next several months?
Well, with hand hygiene, we're going to continue to doing what we're doing. One of the things that we did do, we increased the number of observations. There are more secret observers, and throughout all the departments, we've emphasized hand washing. Leaders in those departments have also commented to staff when they observe non-compliance. So that has resulted in a robust improvement, as you see. We've met our goal of 80% for 2 years in a row, so we're going to move that to sustainable.
And then on sepsis?
Sepsis, again, we've been focusing on some key areas like the lactate, which we need to focus on some more in 2025. We plan to. We also, the response to the Cerner pop-up, we've also been monitoring that to get improvement in response from our staff.
May I add
Yes,
on
sir.
a point? So repeat lactase continues to be our challenge on both sides. So that's something, as Dr. Turner said, we will continue to focus on. However, on the Providence side, one of the other challenges we have is the number of cases. We don't have a lot of sepsis cases. So the challenge is to hardwire those expectations, those processes we have put in place. So that's what we will be focusing on. If we look at the monthly compliance for the past 5-6 months, it has been really trending above our target and even our stretch. So we are making progress, but before we start seeing an uptick on the rolling 12, it might be a while. But that's definitely a focus area. If I could brag on your behalf, I would say out of the 5 metrics that Dr. Turner presented, for 3 of those, the team has increased 20% or more over 2023 performance. So that is tremendous. And I think the most recent Leapfrog Award really validates the work that Providence has been doing. Thank you, Dr.
Thank you. Thank you for sharing that. Congratulations to the team for that progress and the award. So we'll, look forward to continued progress. And the other question about I know we're doing the high reliability training, and how is that working as it relates to these 5 areas?
The focus is to hardwire those safety behaviors, peer coaching, peer checking, speaking up for safety, and paying attention to details. Those, behaviors that are crucial to, helping us hardwire these processes and systems we are putting in place. So that's going well. We are halfway through the training, but we are, coming up with sustainability plans to make sure that it's not just one-time training and once it's done, people forget and move on. So that's the challenge ahead of us now, ensuring that sustainability of those safety behaviors at all levels of the organization.
Thank you. All right. Any questions here in the room or online? No. All right. Thank you, Dr. Turner and Raji, for the Providence Hospital site review. Now we'll do Stroger Hospital site review.
All right, so here we are presenting the new goals we are setting for the operational excellence work groups for Provident in 2025. We started this, process a few months ago where we had challenged our operational excellence diet groups and the executive sponsors to look at best practices out there as well as the current data as well as the goals they want to accomplish, the goals that they are moving towards. So based on all that work, the team at Provident have come up with 3 different work streams. One, patient experience, that will continue to be one of the focus areas. As we have discussed with the board in the past, patient experience, does have, significant weight on the CMS scoring. So patient experience will remain a primary focus for the Provident team, and the goals are listed on the screen. Anywhere we are introducing a new goal, we have added double asterisks next to it to indicate that the team is taking on something new. Clinical outcomes will also remain, but as you can see, we are adding some new goals around decreasing patient falls based on some recent information or data we have. Throughput also will introduce a new goal around, ED admits to, discharge. So those are the goals that we will be reporting out to the board in 2025.
Any questions? Just for the benefit for some that may not know, can you just say what the timelines are for the star rating and leapfrog safety grade? When do you submit and when do they typically announce?
Usually there is a 1.5 to 2 year lag. So, Dr. McGuire?
So in terms of reporting, I believe it's typically in the summer for star rating. I think they've moved it up now to April. Is that,
April,
yeah, Jen's
yeah,
nodding,
that's
yeah. So it'll be a little sooner this year, and then it's spring and fall for leapfrog, so we get twice a year, a letter grade.
So that's when they report out.
Yes, spring and fall.
And we just started reporting for Provident in 2024, so that's
Yeah, and
another exciting development.
It's a bit variable in terms of the metric reporting periods. For the most part, the more kind of hard quality kind of clinical claims type things are about 2 years in arrears. But patient experience weighs in, especially on leapfrog. That is a little bit more current, so that's, a couple months behind. So it's a little variable.
All right. Any questions? Good.
Thank you. Thank you, Dr. Turner.
Thank you, Dr. Turner. Thank you. I have Donica, Austin, Kathy. Stroger. Thank you.
Good morning, everyone, and good morning, Chair Butts and directors. Donica Austin, Kathy, Chief Hospital Executive for Stroger. Thank you for the opportunity to share the 2024 year-end review. Looking at our dashboard, we have 8 metrics that were monitored for 2024. 4 were improving from the baseline. 3 were meeting or exceeding the goal, and 1 had an opportunity for improvement, which I'll talk about. When we look at our patient experience, we are excited about the improvement that we're seeing in our nursing domain. Rolling 12-month percent top box communication improved from 69% in 2023 to 71.8% in 2024. For our throughput, our geometric length of stay is trending down, and so we are, when we looked at our data for 2023, we were trending at 1.9, and we're closer in 2024 to 1.7. So the team is continuing their efforts with our GMLOS. Our clinical outcomes, a lot of great work around our CLABSI and our CAUTI. Our infection rate, we've seen a 14% reduction from 2023 to 2024, and our CAUTI rate is 0.65 for 2024 year to date. We did see our volume of occurrences higher in 2024, but still within the goal that was established. Looking at our readmission rate, a lot of really, really great work there. And as you see, the box is green, because our all-cause readmissions met our stretch goal. Stroger has continuously been trending down and is currently seeing a change from 13.4% in 2023 to 11.76 in 2024. And I do want to call out that they're currently meeting, or the rate is currently better than the state as we look at our Illinois Hospital Association data. So really a lot of great work in our readmissions. And lastly, as I spoke about, the biggest opportunity for us is really in our survey response rate. So that's the box in the middle at the top. Currently, we've seen a decline from 13% in 2023 to 11.5% in 2024. I do want to share that the team has adjusted the survey to align with the CMS logic and are sending more surveys out, which means our denominator has gotten larger. We sent 200 more surveys out this period of time, and so the team is really looking to make sure that patients, understand that surveys will be sent to them. They're checking the patient demographic information when the patient is discharging, so that we can continue to see that number increase. Next slide.
Great. Any questions on this?
Yes.
Director Harrington?
Yeah, the rolling 12-month survey response, the trend is dramatic, but the difference is not significant. But I was wondering, what are you doing to improve that?
For the survey response?
Yes.
Yes. So, right now, okay, so they had to change the survey logic. So right now, there's a work group really focused on making sure that we're sending out surveys, right, in a timely manner. We're also making sure that we have the correct, demographic information, the address information for patients. We're also making sure that patients understand how the survey will come to them, what it will look like, so that, when they see it, they don't think it's, something that they should discard.
Can I add one more point? So, as Danica mentioned, the biggest challenge we have on the Stroger side, and actually for Providence too, is the undelivered mail that we get, after we send the surveys out. So until the beginning of this year, we were limited to just using the snail mail, like the regular mail, to get the, survey responses from the patients. However, we are now allowed to use electronic methods. So in addition to the regular mail, we'll be able to send out text messages and emails as well. So the patient experience team has already implemented that process from the beginning of this year on both sides, both Stroger and Provident. But on the ACHN side, they've been using some of the electronic options already. So we are hoping that, with this additional means of reaching the patients, we would be able to increase the survey response.
And then, Raji, I'll add, so a lot of the upstream challenges that we have are around that accuracy of registration and all of that. So we're actually pulling a group of key folks together to really work through that process. It's driving downstream, clarity issues around note closure, encounter closure, and obviously this, right, when we have errors in registration. So really starting at the beginning of that cascade of that process to ensure that we're accurate in how we're documenting for patients when they come in for care.
And then I think we'll be able to use email as well.
Yes.
Mm-hmm.
Yeah, so a follow-up question. Is the data from this for us, for internal use, or do we report it to some external body?
The response rate is not. The performance on the responses is reported. That's part of what influences our letter grade. That's part of,
Okay.
Okay. Part of the leapfrog.
Question. I heard a lot about hospitals using MyChart EMR-based communication. Are you planning on doing that?
We do currently have a patient portal that allows our patients to access their medical record.
So can you send out survey questions to that?
CMS has some restrictions on us on how we can reach the patient. For example, we are not allowed to give out the surveys while they're inpatient. So there are some restrictions within which we have to, reach the patient. So MyChart is not one of the options we currently have available, from CMS.
Thank you.
Okay, we'll keep going. There's no one online that has a question. Okay.
Next slide, please.
One more, this is
One
program.
more the other way.
Thank you. So here before you are the 2025 Stroger OpEx goals. Obviously, our overarching goal is to increase our CMS star rating and our leapfrog safety grade, which is currently at a B. I do want to note that we're very, very close to that A, and so we're tracking very closely. For new goals, excuse me, for 2025, we've added increasing the provider communication domain to patient experience. We've added the decreasing the mortality index to the clinical outcomes. We have added the decreasing the length of stay for the ED discharge patients throughput, and also the readmissions, decreasing the post-hospital follow-up days.
I have a question.
Yes.
So it looks like these are very general goals. Do you have a more specific quantitative or qualitative goal that you're pursuing?
So there are numbers behind
okay.
all of these. So for example, for the increasing the provider communication, right now the number is at 82, and the goal is to move to 85th percentile.
Okay. So what drives the actual goal from where the performance is at now? So what's the science behind what drives the goal from 82 to 85%?
We do a lot of data analysis based on, what it would take us to get to that CMS A scores, and then identify, opportunities based on our current performance and where we need to get to. So that's always our, our big structure or goal, I would say target goal. So it's based on the data analysis along with best practices out there. But we don't only focus on our CMS scores. If we identify internally that there is a safety opportunity or a quality opportunity to improve any of our processes or outcomes, then we would pivot to. We would add that to, those metrics we think would have, some weight on CMS scores too. So.
Got it. Yeah, I think what jumped out to me was the previous slide on Providence, where, I get the mission is to establish universal access to the world's best care. Which I think is a great goal, but how do you measure the world's best care? So just want to make sure, and that's not a goal, that's just a mission, which I get the difference. But
You're saying having aims is important for each of these areas.
Well, I think being realistic too, and just understanding what drives that differential between where we're at and where we want to be. Yeah, so, no, thank you.
It's a combination. We just don't want to be just driven by the CMS goals. We want to make sure we are doing an internal assessment and identifying the opportunities. And Director Garza, I can promise you that each of these goals have a SMART goal associated with it. So we would talk about, by when, at what percentage, and, all that.
Yeah, thank you.
If you are interested, we are more than happy to share the details of that.
I think we've talked with the team about the sustainability of these practices so that it continues, we maintain the excellence, and once we achieve those goals, be able to maintain them. Yes.
We moved some of the goals from 2024 into the maintenance sustainability, area. So we might not be reporting out those, metrics here, but we won't take our eyes off of those.
Sure. Makes sense. Thank you.
Thank you.
All right, keep going.
Okay. And the last slide for Stroger outlines outlines our work groups and the executive sponsors who will be responsible for these areas. So for patient experience, we have Dr. Jacqueline Witten, who's our CNO for Stroger. Our clinical outcomes, Dr. Peter Hart, who's our chair of the Department of Medicine. Readmissions, Dr. Jabbar. So he was actually the dyad leader and has now been elevated to the executive sponsor, one of our attending medicine physicians. And throughput, Dr. Pierre Coe, who is our associate chair of medicine. And so the dyad leaders have been working very closely with their sponsors. And to the question that was raised before around, the goals, they really have been in the trenches and partnering very closely with quality to make sure that, these are goals that can be attainable, and that we are also looking at the Vizient data to make sure that this is something that can truly be achieved for the year.
And is there any, also, I know we've talked about this some before, stratification of the data, by either place, population group, so forth, to look at any of the gaps of the disparities in outcomes that may exist?
Yes, we do have monthly updates from Vizient where we request them to stratify the data based on patient population specific.
Okay, thank you. Any questions?
Thank you.
Thank you, Monica and Rajiv. We'll go to ACHN site review. Craig Williams.
Hi, good morning.
Good morning.
Craig Williams, Chief Administrative Officer for Operations and Development. I think this is my first time presenting this committee, so
Welcome.
it's a pleasure to be here. And I want to go through the ambulatory care networks 2024 performances and then an overview of 2025 goals. So the top three boxes on this schedule show our performance against patient experience. The first metric being concern for the nurse assistant for the patient problem. We've been consistently better than baseline here, but we haven't met our 2024 goals. We ended 2024 at 60.84% compared to 58.91% in 23. So while we have had a 3% change in improvement, we haven't reached the goal in that metric. On the care provider explanation of problem condition, we've consistently performed better than baseline here, but we've not met our 2024 goals. We ended 2024 at 65.97 compared to 2023 at 64.98, so a minimal 1.5% change in 2024. And then the courtesy of registration staff, we have met that goal. We ended 2024 at 61.66 compared to compared to about 60% in 2023. And that's been a 1.25% change of improvement year over year. On the bottom two are two quality metrics, the first one being around hypertension. And we've ended the year meeting the goal monthly at 52.7 compared to 52.2, so about just under a 1% change in improvement. And monthly, we've been improving, we've been meeting those goals on a monthly basis. For cervical cancer, we've ended the year meeting the goal monthly. We're at 44.7% compared to 2023, which is at 42.8. So we continue to make progress on that goal month over month. Yes.
Any questions?
Yeah, I appreciate your sharing the goal, because it's not included in the slide. It should be easier to see the relationship to the goal and
Sure.
the data, the actual data.
Okay.
Other questions? Good. All right. Keep going.
So for our 2025 goals, we've really looked at places that we've been performing well, and also which things we think are most going to move the needle in terms of quality, but also in terms of meeting the overall Cook County Health goals. So in patient experience, we've worked very closely with with Press Ganey to understand the key drivers of our overall scores. And these three goals that we've selected for next year will be most impactful, according to Press Ganey, to moving our overall score. So the first is the increasing staff working together for you. And so how do our our patients feel about the cohesiveness of services that we're providing. We want to increase our top box score on provider addressing concerns and worries, which is a carryover from this year. And then also new for this year is provider explains the problem condition top box score. So those are our patient experience goals for this year. We have a patient experience team that's currently covered on an interim basis through one of Lynn Dang's managers. Her and I are jointly recruiting for a new manager for patient experience for ACHN. A newer quality goal for this coming year is around empanelment. Obviously, one of the things that we do that's most important across ambulatory care is provide access to patients that want to receive care at Cook County Health. And so we think it's really important to increase our overall empanelment across our primary care base. And so we're doing a lot of work on not only ensuring that everyone has equitable numbers of empaneled patients across our primary care network, but we're also doing some work on looking at health and age scoring to make sure that there's a balance in what people have in their panels. There's a group working on that, which I'll go over next. And then on HEDIS, we have selected two there. So one is increasing our breast cancer screening rate. This aligns very closely with the new Cook County birthday screening program, where we'll be screening for breast cancer and for prostate cancer, and so that will fit very nicely with that goal. And then increased hypertension management compliance rate, and that's a place where we've been just lagging a little bit in terms of our performance over the last several years. Yes.
Yeah, I'm not clear on what increased staff work together means in terms of what the problem was. I mean, I'm assuming they're working together now, but it must be.
You know, I think that the feedback that we get from Press Ganey surveys is that patients don't always feel like the staff is really working together as a team, really, that, you know, that the handoffs aren't seamless. And that's what we're building a lot of programs at ACHN to really try to build and model that seamlessness so that the handoffs are happening. People are talking up that next level. Oh, you're seeing Dr. Makaitis. He's an excellent provider. You're going to really enjoy your time with him today. That may not have been a great selection, but no.
Bad example, Chris.
Yeah,
no, yeah, it's about kind of that scripting and managing up and how we kind of ensure that the patient's perspective is that we're all on the same team and that we're working together.
Yeah, 2024 was an excellent year for ACHN because we established a separate work stream for ACHN. Until then, they were kind of working through either Georgia work streams or Providence. So the team has done a wonderful job around that. And in 2025, they're introducing a totally new work group too. So a lot of great work happening.
Yeah, we were tired of living in the shadow of the hospitals. We think ambulatory care is pretty
I
important.
think in general, there's been a lot of expansion in terms of the infrastructure for those more tenured board members. You might remember, I mean, it used to be like 5 measures that we would present every month, right? I mean, this has grown a lot. Each division now has kind of taken ownership of their internal work, and kudos to Raji and quality team for kind of building that, continuing to build that infrastructure. If I could just comment real quickly on the empanelment, I think it's important also in that vein of our drive towards population health and focusing in on value-based care, that work is going to be crucial in terms of ensuring that we have the right providers tied to the right patients. We've, you know, engaged in 3 now value-based care contracts with the 4th kind of ready to take off, and 4 additional planned for 2025 in addition to potential ACO engagement as well. So we should be in 8+ value-based care contracts by the end of 2025. So a bit of a transformation happening, especially in the ambulatory setting. So kudos to Craig for that.
It's a change management transformation happening.
Yeah.
Yeah, I'm reminded of what Peter Drucker said, you can't manage what you don't measure. And that's what all this is about.
Yeah, there's been a lot of great work by the team on, you know, greater sophistication, organization. It's these work streams, it's the RCA work streams with the various sites, and then just being more focused on the, you know, the measures and the improvement and the high reliability work. So a lot of kudos to, you know, the entire team on the progress, and appreciate the commentary on what improvements we're going to make ahead. I had a couple questions on ACHN. The improved care gaps, are there particular care gaps that you're focused on that goal, the overarching goal? And then when I look at HEDIS, I look at, just the incidence of cancer in younger people, and that rising, how do we think about colon cancer screening or, other areas, making sure that we're continuing, focus around those?
Yeah. There is a lot of work happening around care gaps, and I think that goes along with Dr. McKitis' comments around population health management. We actually have re-engaging, and there's a change happening with our care coordination team that's been in. County care is now going to be more embedded into our ambulatory care sites. And a lot of the work that they'll be doing is mining the electronic medical records to really understand folks that have gaps in care and to bring them into the clinic, get them seen virtually through our Express Care program, but really have some of those things closed. I think, the Cook County Birthday Screening Initiative is one of those care gaps. I think that will sort of give us an entree to people calling in and engaging with us, that we can also be closing some of those other care gaps that we see within the medical record.
I think that care management restructure is going to be key, and especially as we enter into those contracts that I referenced a minute ago, there's usually payer support as well that augments what our care managers are doing in terms of like being boots on the ground, but very much, looking at not just care gaps, but leveraging information exchange to ensure that, someone who's in the ED yesterday is getting engaged the following day, they're getting a phone call, hey, how you doing, what happened, right, to ensure that there's that additional level of connectivity. But yeah, I think with this restructure, I'm very hopeful that we'll be engaging in a very different way with our patients.
Great.
Thank you.
Sure.
Any other questions? No. Gonna go on to the next slide.
The next slide just outlines our organizations across the goals. So for patient experience, the executive sponsors are myself, Sharon Irons, and Lynn Dang. The diet leader is James Driscoll, as I mentioned, and we will be hiring a manager for patient experience. For our HEDIS Healthy Registries work group, Sharon's going to be busy this year. We'll be, again, leading that group with Dr. Adio and Beth Vakovich as our nursing leader. And then empanelment is also going to be Dr. Sharon Irons, but Dr. Dan Veedham has really stepped up and has done a lot around empanelment. But we know we need probably more horsepower and outside guidance on creating those panels and metrics around that. So we will likely bring in some outside resources around that.
Thank you. Any questions? All right, thank you, Craig.
Thank you.
Appreciate Dr. Turner and Donica and Craig for their work and presentations, and Raji for your support work. You have any other points here?
One last slide.
Okay.
We're introducing some changes, as I mentioned at the beginning of the presentation. So the main change would be that, the chief health executives and chief administrative officer will be co-presenting with the chief quality officer at QPS board. One other change is that oftentimes, when we bring the work group leaders to present on the status of the tactics or the metric performance, the presentation feels a little rushed because we have time constraints. So we are moving those work group level presentations to the quality governance committee, where we have time allocated specifically for those presentations to take place, where board members can ask like in-depth questions on the tactic implementation, the operational piece of it, or even, the metric performance. We will continue to have a steering committee meeting where all the work groups will be presenting their data monthly to receive feedback from site level and system level leadership. We also, we will continue to use that platform to cross-pollinate best practices within the system while they, receive feedback from leaders across the system. So those are the major changes. We will continue to use the A3 worksheet, which the board has seen in the past. We have made some modifications to how that worksheet looks based on, feedback we received from internal as well as from the board in the past, internal leadership, internal users as well as the board. Yeah.
Does that mean there are going to be more meetings, or that means there's going to be more teamwork? I mean, and less meetings?
More teamwork. there will be more time spent on explaining the barriers and the challenges the team teams experience with the board, where, board might, might step in and, help remove some of those barriers. Here, when they present, they get 5 minutes and they are rushing through the metrics and just, answering very high-level questions. So
But the actual number of meetings they attend will not be the same.
we actually reduced the number of meetings.
That's
The
what I
work groups, because they were going to the steering committee meetings and then, site-level quality committee meetings and here. So now it would be just 2 meetings.
I applaud you for reducing the number.
Yes, we're always good at streamlining.
No, we are very intentional about giving them time back to doing the important work they need to do.
And this is part of, we organize as part of also how we need to maintain credit, around some of the regulatory and other requirements. But the way that it's organized, I think, gives us good insight into your continued progress and improvement.
Thank you.
All right. Any other questions? Thank you. Appreciate it, Raji. We'll go to our reports on other quality and patient safety matters, starting with regulatory and accreditation updates. Read by Joseph Capenas, Director of Quality Regulatory. Thank you. Welcome.
Morning.
Good morning.
I just want to give a quick regulatory update, some of the upcoming surveys. So, slide up. So we're expecting at any time now, I've been saying that for a number of weeks, the Illinois Department of Public Health, or IDPH, outpatient dialysis recertification survey. In December at that point, but we've obviously moved a bit beyond that. So at any time, looks like it's going to probably be 1-day survey, 2 to 3 surveyors. And this is a certification that happens every 3 years. So again, maybe it comes and happens next week, but we're looking forward to having that. We've been prepping and we're ready to go with that. We're just waiting for the surveyors to arrive. As far as here at Stroger, TJC, or Joint Commission, primary stroke, providing mechanical thrombectomy. It's a recertification survey. The window opened on January 10th, so a week ago. It's open through April 10th. We're looking at 1 surveyor for 2 days. We've been prepping for that, and I do want to mention at the top here, the first bullet, we are planning within the next 2 weeks a mock survey here as far as preparedness. And that we'll look for deficiencies. We'll work with staff as far as just preparedness, going through that and see what we can find for challenge areas and takeaways, so that everybody will be prepared. A dry run is really a positive thing because, again, it gives staff some experience of what to expect when the survey happens. And you're looking at the mock surveyor, so looking forward to that in the next 2 weeks. Joint Commission, or TJC Health Equity, it's a new certification we're going for. We're looking at 1 survey for 2 days. Preparation is currently underway. We're looking at right now a ready date of June 10th. So again, it's typically about a 3-month window. Sometime 60 days before June 10th. So April 10th, I will get notification from Joint Commission for a document upload, which is basically documents in advance of the survey, so the surveys can take a look at certain things. They'll ask for policies, process. A lot of times they'll ask for a org chart. So we'll get all that taken care of in advance. We also have a project lead on that. So that's coming down the road. It'll be a first-time certification. I think we're going to do very well with that. And then I've also got here American College of Surgeons Bariatric Accreditation. It's for a certification survey. So preparation is currently underway with that. As far as the window, sometime between June and July this year. So again, it's going to be a busy summer as far as some of these accreditations. Forgive me, I forget the name of the physician lead on this, but I've recently, in another institution, gone through this, so I'm very familiar with this type of certification. The standards, the level of intent of meeting the standards, the book of truth or source, so to speak. So I'm going to work with our physician lead on that, make sure we're prepared for that. And lastly, I don't have it on the list here, but I just found out about this within the last few days or so. American College of Surgeons Trauma certification. So I recently reached out to Dr. Williams to get more information on this. I obviously can do research on my own, but I would like to find out where we are in this process. I was told, I'm not sure that this holds true, is not completely accurate, but I'm thinking August of 2025. Is that correct? So, so again, forgive me, I don't know exactly where we are with that. My guess is it's American College of Surgeons, very similar to bariatric as far as book of truth or as far as meeting the intent of standards to be able to present. But I want to get more information, so again, I did reach out to Dr. Williams. I hope to meet soon and go over, kind of where we are and when we need to get between now and August so that we're prepared for that. And those are everything that I'm aware of as far as updates, as far as upcoming surveys.
Thank you. And I know County Care is also pursuing an NCQA as well for
Sorry, say
health
again?
equity, NCQA health equity accreditation.
Okay.
Yeah, if possible, I'd like to see the metrics that establish equity. Be interesting just to look at what constitutes equity in terms of metrics.
Yeah. Yes. And this is a Joint Commission National Patient Safety goal now on health equity, so it's been elevated. So it's great to see this work.
Yeah, this certification goes well beyond, there's, I think, 2 metrics, right? And this is a full-on certification program.
Any questions, comments? Online, any questions? No. Okay, well, thank you, Joseph. Appreciate it, your work on this. Committee will not be going into closed session today, so if there are no other questions or matters to discuss, we can move to adjournment of the meeting. The agenda exhausted, the meeting's adjourned. Thank you, everyone.
Thank you.
2 minutes over. Oh, 28 minutes early. Oh, all right, I'll take that.